Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. This is Monday Health Minutes. Today we're talking about lifestyle medicine, and this will get your attention. There is new evidence, mounting evidence, indicating that modifiable behavioral risk factors are what drive the leading causes of death in the United States. That's kind of surprising. So we're talking with Dr. Cyrus Hajiran about lifestyle medicine, what it is, and how it can really make a difference in your health. So explain to us, this is a kind of a new movement.
Sure. So lifestyle medicine is all about applying evidence-based therapeutic interventions regarding 6 major pillars. Those are food, the way you move your body, exercise, sleep, stress management, avoidance of risky substances, and social connection to optimize your health and prevent, treat, and even reverse chronic disease.
Prevent, treat, and even reverse. So these are things that we do or don't do that are having a direct impact on our health.
Correct. So, preventative medicine, or lifestyle medicine, is kind of a new field emerging in the United States. There is a new college, the American College of Lifestyle Medicine, which is kind of paving the way for this movement. But essentially, a lot of physicians in the United States talk about like burnout and trying to make a difference. And for example, if a patient comes in with high blood pressure and I treat a medicine and I fix a number, that's helpful in a way, but it's more so treating a symptom rather than, trying to cure or address an underlying disease process if there is one. A lot of the times, what people eat or, how much they move or how well they manage stress are really these underlying driving factors that create or lead to these chronic diseases. And we don't do as good of a job talking about those or trying to educate or motivate people to fix them as we do prescribing meds.
Right, so instead of lifestyle medicine, instead of maybe writing a prescription for a medication, you would write them a prescription for a behavior change.
100%. And, going to med school in the United States, actually, we don't get a lot of good education on how to implement lifestyle medicine. A lot of the major accrediting societies in the United States for standards of care and health, like the American Heart Association, the American Diabetes Association, the American Cancer Society, will all list lifestyle intervention as one of the first-line treatments for any of these chronic diseases that lead to heart attack, stroke, different types of cancers, high cholesterol, diabetes, but we don't do a good job on teaching healthcare providers how to, assess where people are and motivate them to change. We often stop short with asking people what their diet and exercise is, and they'll tell us, and then we say, okay, we probably should do better, and then kind of move on and then write a medicine. Mm-hmm. And so it's all about kind of changing that and really going after that.
So how would you change it? If somebody comes in, say, has high blood pressure, you would say diet, exercise, and then what would be your behavior modification?
Sure. So really, one of the difficulties of implementing a lifestyle medicine is it is time intensive. So we really would need to spend a whole visit breaking down some of these pillars or elements. Mm-hmm. Like, for example, just focusing on diet. That can be complicated as far as, the reasons people are choosing things to eat are sometimes in the constraints of, what access they have to food, mm-hmm. How much, money they can spend on food, what they like to eat, what their kids like to eat. So really trying to go full picture on figuring out why someone is doing what they're doing, why maybe it's not helping them, achieve the quality of life or do what they want in life, or achieve the health status they want in life, mm-hmm. and then figuring out a way to help them make those changes so that, they can improve their health.
What an interesting conversation about how our changes in lifestyle can have such a direct correlation to how healthy we are and what disease state we're going to be facing in the future. Thank you so much for all of your input. I really appreciate it, Dr. Hajiran.
Sure, anytime.
Thanks for being here for Monday Health Minutes. We'll see you next week.